yeah. We hope we will have an interesting live session, interactive, and we will benefit all of us. As I am interested in preparing it, I hope you will be interested in hearing and participating in this session. I believe that listening skill, if you master listening skills, you master a big part of communication skills. Thank you very much, Zina.
Okay, so we are going to start with the pre-test, or do you want us to introduce the participants? Dr.
Yes, I like them to hear from them, then
yes.
We give time for others to come in, to jump in, then we will give pre-test. Okay, please introduce everybody, introduce himself, so we know each other.
Okay. Okay, Nahid Azazi, can you start introducing yourself?
Yeah, please. Yeah, please. Nahid Azazi.
Yes.
Can you introduce yourself?
I am Nahid Azazi.
Please introduce yourself and your degree and why you are choosing the this Academy of Public Health.
I am Nahid Azazi. I am a medical doctor. I have a diploma degree of public health. I am interested to improve my communication skills in the public health, so I choose this course. Yeah.
Thank you very much, Dr. Nahid. Who is the next, please?
Let's go for Dr. Abir Abdelaziz.
Assalamu alaikum. I'm Dr. Abir Abdelaziz, Biorisk Officer of Central Public Health Laboratories, Ministry of Health, Egypt. Also, I am a Technical Manager of Food Microbiology Department. I am very interested in this course because I want to gain more experience, more knowledge about the skills of communications, because I have many teams, the teams of food microbiology department and team of biorisk management in my institute. So I want to know how to deal with these teams, how to overcome the resistance of change, and so on.
Thank you, Dr. Abir.
Thank you so much. Muhammad Gouda.
Hello everyone, I am Muhammad Gouda, pharmacist, preventive medicine officer in Port-Said Governorate, Egypt. I am a FTP graduate, from Egypt. I have a lot of teams all over my governorate who I train. I am training them on communication skills for presenting their work, their field work, and in all public health departments. I need to improve myself to help them to be improved.
Very good, very good. Thanks for presentation.
Thank you. Haneen Dagher.
Good evening, everyone. My name is Haneen Dagher. I am a content development at GHD Infinite, Eastern Public Health in Jordan. I chose this course to enhance my skills and to ensure a progress career in the future, inshallah.
Welcome.
Thank you, Haneen. Dr. Zainab Abbas.
Good evening, everyone. I'm Dr. Zainab Nasser Abbas, and I'm a FETP graduate. I'm working in Iraq Ministry of Health. I'm National Coordinator for the FETP training. Also, I'm as a RAC ambassador in the FETP ambassador program with the INFNET. Actually, I joined this course because I see the communication is very important, especially in my work, because I communicate with so much people in different levels and also participate in the training. So I see it's very important to me. Thank you so much.
Dr. Zainab, you are working in Ministry of Health headquarters?
Yes, in Ministry of Health and the Public Health Directorate in FETP department.
Okay, welcome. I will visit you.
You're welcome. Thank you, Doctor.
Okay, thank you very much.
Thank you.
Thank you, Zainab. David Mendoza.
Hi, good evening to everyone. Thank you for accepting my application as part of your team in this organization as part of your student. No, I'm an FETP graduate also in the Philippines. I am currently the division chief for the local health support division. I do indeed involve myself in more or less almost all communication. I had some problems, especially the barriers in communications among our fellow countrymen. So I'm interested in this course to learn and to improve myself in communicating to others. Thank you.
Welcome. Where are you from?
I'm from the Philippines, sir.
Philippines.
Mindanao,
Welcome.
Philippines.
Mhm.
I think I'm the only Filipino joining here.
Yes.
Welcome,
you are.
Filipino.
You're welcome. Asma Hashim. Dr. Asma Hashim. Maybe she's not hearing us. Lana Khalid Rababa.
Hi.
Hello. Can you introduce yourself, Lana?
Do you hear me?
Yes. Yes.
My name is Lana Rababa. I'm from Jordan. I'm working as a community pharmacist. Actually, I'm very interested in communication skills since my work require to be professional communicators, either with people or community and with my colleagues. Recently, I'm a supervisor of icebreaker team. I'm a manager of 3 pharmacists who represent cosmetics materials. So I'm very interested in communication skills with them, leadership skills, since this management is new for me. So I'm very interested in communication skills and leadership skills.
أهلا وسهلا لانا.
Welcome, Lana.
Welcome.
إسراء محمد نور.
Hi, I'm Isra Mohammed Noor. I'm from Sudan. I'm a community pharmacist, and also I have a Master of Public Health from Ahfad University. I'm interested in communication course because I need to develop and advance myself in how to communicate with others. Our work depends how to deal with different community and different experience. So I need to develop myself in how to communicate. Thank you.
Thank you, Sira. Salma Abdul Momin.
Yes, it's Salama.
Salma. Yeah. Yes,
Salama Abdul Monim. Hello.
Hello.
My name is Salama from Sudan too. I'm a medical a doctor and a public health officer. And I heard from this course from my boss in Gender and Reproductive Health Center, and I was interested in this communication course since I work also as a lecturer for epidemiology and health environment for medical students. And I think that this course will enhance my ability and skills to communicate better with my students and to give them a better experience and to deliver to them a good knowledge regarding anything related to medicine. Thank you.
Welcome, Salam. Thank you very much.
Thank you, Salma. Rasha Hussein.
Good evening. I'm Rasha Hussein. I'm also from Sudan. I just finished my pediatric residency in Sudan, and I'm also about to finish my PhD in Pontificia Universidade Católica do Paraná in Brazil. So it's about to finish my PhD also. I graduated from the FET program in Sudan, and I'm involved in many researches. I also responsible for the research department and Minister of Health, Khartoum State. So this topic is highly important for me, especially in area of research and area in pediatric, because I believe that I'm only a pediatric resident here in this group. So this communication skills is highly important for me to develop my communication skills and to develop my communication with other colleagues in my research area. Thank you.
Thank you very much.
Rasha. Abdullah Muhammad.
Good evening all. I'm Dr. Abdullah Muhammad. I'm a health project consultant with the Mid Global Organization. I had a Master of Public Health from Sudan, but originally I'm from Yemen, as well as I have worked as a lecturer in the university and as well as worked in so many researches even in Yemen and Sudan. Currently, I'm in Egypt doing the fellowship in healthcare management, and as well as I'm a PhD applicant in the University of Science in Malaysia. Thank you so much.
Welcome, Abdullah.
Sarah Farhan. Sarah. Asma Hashim. Okay, they are not hearing us. We can start, doctor, with the pre-test. So, can you please, Shema,
tell them about something about pre-test?
Yes.
I will tell you something about pre-test.
Okay.
These are true and false. 10 questions are about listening skills. This just I know how much you know about listening skills, so I can proceed what depth I will talk about communication skill, listening skill. Then I will repeat the test. We call it post-test after the live session. So feel free to answer easily. Don't think a lot in answering the questions. Okay.
Okay. Let's go.
So please answer these questions and we will see.
You have 4 minutes is enough, doctor?
Yes.
Okay. You have more 4 minutes.
Just tick true or false. Just.
Excuse me,
Yes,
where is the test? Where is the test?
You can't see the test? Just, do you see the polls? Okay, next to the participants, chat, there's polls. At the bottom of the screen, if you click, if you can see, you have the mic, the video, the participants, and there's polls.
Yes, the mic, the video, the participant, the chat, and the reaction.
There's the polls. You can see it?
No.
Sarah cannot see the test. Zina.
Okay.
Sarah cannot see.
And also,
And Abdullah Muhammad had a problem in internet.
No, he just introduced himself.
Okay.
We have Haneen Dagher finished it, and Abdullah finished the test. Mahid, بتقدري تشوفي من تحت وين عندك المايك، بعدين عندك
شايفة المايك وبعدين الفيديو وبعدين البارتيسيبانت وبعدين التشات وبعدين الرياكشن.
ليه مش مبين عندك؟ مش مبين عندك البولس؟
مش باين عندي ايه؟
بول.
لا.
عفوا، بس حضرتك فاتحة من الموبايل ولا من اللابتوب؟
لا، من الموبايل. اللابتوب مش راضي يشتغل خالص، مش راضي يطلع صوت. انا فاتحة من الموبايل. يمكن عشان الموبايل.
Yes.
Okay. مش مشكلة.
No, also I'm using my phone, mobile. So in options more, we have poll. We can use it.
Where exactly? From
more.
Options? More.
Yes.
No.
After whiteboards, we have more as 3 dots. Please select it and we have poll choice. Yes.
Okay.
Thank you.
Thank you so much, Isra. Nahid, did you find it?
No.
Okay. في 3 dots. 3 dots and more.
I don't see.
more. عندك more؟ تقدر تشوفي كلمة more؟
لا، ما فيش more. لا.
طب dots 3 dots.
لا، مش شايفة 3 dots. آخر حاجة عندي الرياكشن. وأنا عندي مشكلة في اللابتوب النهاردة بالذات، مش مطلع صوت، عشان كده استخدمت الموبايل.
اوكي، مش مشكلة ناهد، أنا بقدر أبعت لك إياه إيميل.
اوكي. وأنا اوريدي عملت البري تيست وبعته.
لا، بس هذا مختلف. هذا بس اوكي تمام. ناهد شيماء، بتقدري تشيري البوست تست مع ناهد إيميل؟
اوكي
تمام.
Thank you.
You're welcome.
لازم حضرتك معلش، أنا كمان مش ظاهر عندي.
وسارة كمان شيماء لو سمحتي.
اوكي تمام.
اوكي.
طيب تمام. هلا احنا عنا 10 participants من بين 15 اللي خلصوا، فما بعرف اوقف البول ولا لا.
لا كملي، خلي يكملون.
اوكي تمام.
طب انا مش ظاهره عندي الامتحان.
هلا نبعت لك يا ايميل ساره.
خلاص
ساره من عند مور.
عندي مور. تمام.
اوكي، في مور، في بولز.
لا مفيش. في اللي هو الشات والميتنج سيتنج. وفي البولز.
هي البولز، هي افتحي.
تمام اوكي.
اوكي
تمام. نعطي كمان. It will be faster.
اوكي. لانا تقول if you send them in chat it will be faster.
خلاص already شيماء بعتت لناهد.
Okay. So let them complete and I will introduce the subjects. It is not so they will take 1-2 minutes more while I am introducing the subject. Okay. I will share the presentation. Okay. Our talk today is about active listening in medical practice. This is the most important skill in communication. If you want to communicate, you should first master your listening. Without listening, you can't do communication skills. It is the cornerstone of communication skills. And we will elucidate, we throw some lights about these important skills which we are ignoring in our practice and in our life, even in our life. It is, we think that it is, we talk a lot, but we listen less. Okay? Everybody hear me? Zina, is my sound, is it clear?
Yes.
Okay,
Doctor, can we wait just 5 minutes?
Yes, 1 minute more.
Okay.
Yes.
Here's the results for the test.
Yes.
Oh.
Yeah. It is just one question for the pretest?
It's 10 questions.
Okay.
You have to say true or false for the statements. Is the statement true or false? So, Doctor, we have the first question, the second question. The majority said, all of the participants said the first statement is true. The second,
I didn't answer yet.
Okay, shall we wait 5 minutes?
Yes, but I don't know if I received it in my mail or not. Just mail.
Okay. So we can wait and because
how many people we are waiting for? 1, 2 people, 2 person?
Nahid, we're waiting for Nahid and some are praying.
Sarah. We are waiting for Nahid and Sarah?
Yeah, they are praying. Nahid, Sarah and Haneen are praying.
Yeah.
يعني
إسراء.
I have question أو معلش أنا طلع لي all statement are true.
No, just no. هم 10 statements. اقرأ الستيتمنت حط جنبيها true or false بس.
أكتب يعني أكتب true or false.
أنت خليهم عندك يعني اكتبي بس عشان يبين عنا يعني تقولي لنا إذا أنت ماشية.
أنا مش عارفة أكتب فين. أنا مش عارفة أكتب فين.
لا اكتبي أي مكان. هو هذا البري تيست إلك. إلك بس لإلك for your information. To test your information pre and post live session.
Okay, thank you. I finish.
Okay, Doctor.
Okay. Shaima, have we finished?
Yes.
Okay, Doctor, tamam.
Okay. Thank you very much. So, as I said, active listening is the cornerstone of communication skills.
I'm sorry,
if you
Doctor.
want to learn.
Sorry, Doctor, for the interruption. Can you put it on the presenting?
Yeah, please.
The full screen.
Yeah.
Down.
Shall I cancel my sharing?
No. Just share from your side, but just put it on the full screen.
Yeah. I will put it on full screen. Okay.
Yes.
That's good. Okay.
Thank you so much.
So it is communication skills. The cornerstone of communication skills is active listening. So we will discuss some, I will throw light about some important points about communication skills. Okay? Communication skills, our aim in this live session is to define what do we mean by listening skills and to explore the importance of listening skills in our practice and to learn some techniques necessary when we are listening and to identify listening barriers. And finally, there is some application of listening skill in medical interview, which is the most important aspect in communication skills in medicine. Okay? So we start with definition of listening skills. Introduction. We live in a communication era because of a large number of communication tools in our hands. We have social medias, multiple kinds of social medias. Facebook, Twitter, Viber, WhatsApp, mobile phone, internet, emails, a lot of social medias we are using, but we haven't enough time to listen. This is interesting that we have a lot of communication tools, but we don't listen. That's the problem in our in contemporary life. We are losing our listening, and we need to learn listening skills when we are mature and we are adult. Listening is not sitting and doing nothing. We should know that listening is not only physical presence. The other person needs your present physiologically, socially, and emotionally. So he needs more than physical presence. He don't want you as a recorder. He like you to interact with him when he's talking. So we can define listening skills by hearing with all your sense. I asked one of the pioneers of communication skills. I told him how I can hear by my all sense. He told me that you should hear by your third ear. I told him, where is my third ear? He says, all your senses are your third ear. So it is a highly skilled process that requires focus, facilitation, waiting time, and picking up cues. And I choose this picture, is very interesting. In the face, in our faces, we have 4 organs for listening and 1 organ for speaking. What I mean is we have 2 ears to listen and 2 eyes to observe how he is speaking. So we are 4 organs for listening, while we are 1 organ for talking. And 1 organ overcome on all these 4 organs. So we need to return back and listen more 4 times than we are talking. That is the message of listening skill. This is the definition of listening skills. How it is important. Look to Chinese language. Very interesting, this drawing. This is the letter of, this is the word of listening in Chinese language. This is the eyes, and this is ears, and this is the heart, and this is the mind. So we, in Chinese letter, they represent all the senses, the ears and the eyes, with the heart and the brain. So we should think and emotionally charged when we are listening, not only hearing. Hearing is a physiological process, while listening to understand and reflect and respond. This is the difference between hearing and listening. So what is the importance of listening skill? Imagine we are practicing listening skill in our life. Our relationships will improve at all levels, at family level, work level, and community level. There will be much less misunderstanding and misinterpretation. And we will have a good convincing results in our discussion and in our life actions. And the conflicts will decrease if it doesn't end. And our era should be shifted from communication to listening. These are the importance of listening skills. All the world will be changed to more peaceful, friendly life. What are the techniques which we are using in attentive listening? We have 4 techniques, important techniques to apply. First of all, we should wait when any person in front of us talking, we should give him a time. Then we encourage him to continue, and we should master our verbal skills, and we should pick up the verbal and verbal cues which he is imitated. So I will discuss every item from these techniques in some details. First, waiting time. Studies shows that the speaking rate was 150 words every minute, but our brain are able to think by 600 words. So if we are not concentrating for the speaker, we might our mind will go to think in other things, not concentrating. So some people can think in many subjects during one time. So this is per part of 450 words. We should concentrate on what is the person who is in front of us talking about. We should delete all the bias in our brain and let these 450 words to think about what he is talking about. So we should give the person time to express his ideas. How he can express his ideas? We start with open-ended questions, no listening with close-ended questions. So first of all, to take a waiting time, to give a wait time for the person, we should ask the person or let the person to talk freely, and we should listen. And we should help this waiting time, help the person to think, reflect, and contribute more. On other side, this waiting time gives us time to think and listen and respond flexibly. So we should shift our mind from speaking, the importance of speaking, to the importance of listening. So waiting time is essential for listening. The second, when we wait for this time, what we will do? We should facilitating response. We should use facilitating response. Facilitating response have grades. What do we mean by facilitating response? We are actively encouraging the person to continue storytelling. The first step, we should encourage him in a neutral way. We should say verbal and non-verbal cues. We should give verbal and non-verbal cues neutrally. We don't interfere what he is talking about. So we say, continue, yeah, I see. These are the terms that it is neutral. It gives a message for the speaker that you are interested in what he is talking about. And the message is not interfering with his talk. This encouragement, the neutral encouragement, should, during the neutral verbal and nonverbal cues, there should be a silence. A silence is a negative part of listening skills. We should stop emitting anything. So following our cues, our verbal and nonverbal cues, we should wait. It is difficult to master. Great doctors who can tolerate silence. Research shows that silence is tolerable by the patient more than the doctor. The doctors have less tolerance to silence. So we should train ourselves to become more, to give silence to our patients. The third stage is echoing. It is slightly directive the person to talk to direction which he is talking about. So we might repeat his last word, or we repeat his last sentences to bring his attention. This is an important subject to go deep in it. And after echoing, we might, when there is a lot of speech, he is talking more than few seconds, we will summarize and clarify his speech. This is very important, that don't explain or add some words from yourself. Let your summarization exactly what he is saying. And if there is some ambiguous word or ambiguous term, you ask for clarification. You should have a courage enough to ask the person, what do you mean by this point? What do you mean by this word? This is a very important, that you will be a common ground understanding between you and the speaker. And the other step, which is more sophisticated, is paraphrasing. Paraphrasing, it means that you summarize by your own words to share your understanding. It combines facilitation, summarizing, and clarification. And the last stage is sharing your thoughts and ideas before asking any questions. Like you said, I think the things is like such and such. What do you think? These are the stages of facilitating response. Okay? This facilitating waiting time, during waiting time, we should go in facilitating response. Moreover, we should use an appropriate nonverbal skills. Like this sitting, it is important that we should lean forward and eye contact with facial expression to give an impression, the first impression, which is very important. By our nonverbal skills, we can give the first impression to the speaker or to the patient, which give him the trust, and we will gain his trust from our behavior, nonverbal behavior, than our words. So, using an appropriate nonverbal skills, the most important is eye contact, gesture, vocal tone, facial expression, touch. Touch is a therapeutic nonverbal skill, very important. Physical appearance. These all give the person a very interesting, a very important message that I am totally listening to you. My body is listening to you. Look to this doctor who she is facing the person and bending forward, and she tell her that I am, all my body are hearing. I hear you by my heart and my brain and my all senses. And I have video. I like to, Shaima will present this video to you. What I would like to you, look to the doctor, how he is using his nonverbal skills for the patient. how he empathizes the patient with no talk, with no word. So please, Shaima, will you kindly present the clip, short clip, half a minute?
Doctor, just press on the video, please.
Okay.
Yeah.
Please, this is a half minute video clip, and look to the doctor how he is. Please put in a chat bar what you are noticing in this nonverbal skills which he is using with the patient.
بس زينة ما في صوت.
Even حتى Zina, we don't need any sound.
Okay, great.
We just look for nonverbal cues, which the doctor is emitting for the patient to continue the discussion. Okay?
Okay.
Okay, please write in the chat bar what you have observed. Dear participant, look carefully and write in a chat bar. I can't see the chat bar, Shaima.
Okay.
David is saying nodding and comforting.
Who said what?
David.
Yeah.
Yeah.
What he said?
Nodding and comforting.
Yeah, he is nodding and comforting. What do you mean by comforting, David? Nodding, we understand nodding, but what do you mean by comforting?
When you look at the doctor, he's trying to reach something for the patient.
So you should say
by offering, but
yeah,
by offering the tissue, yeah, that's comforting enough.
No, we describe what we see, not don't judge the doctor. Don't judge he's comforting or he is emotional or whatever. He is nodding. Yes, you are good. That is very.
Yeah, but he's offering something. That's something to be comforted to.
Yes, he is nodding, and Abir said emotional. What do you mean, Abir, by emotional? Very emotional.
يعني عطوف مهتم بيها.
Please describe the nonverbal cues which he's using.
Very kind, very important to his impressions.
Yes.
To her feeling.
How you judge that he is very kind? How you judge that he is very kind?
Every time he bending his
so good. He is bending forward. That is Abir. Okay. He is bending forward. He is nodding. Okay.
Yeah.
And who's there? Eye contact. Very nice. Lana says he has a good eye contact and facial expression. His facial expression is it means that he feels the pain of the patient. He felt the pain of the patient. Okay. Who's next? Abdullah. Eye contact with attention. If he give her, he is listening by his heart. He's listening by his brain, nodding, bending. Zina, sympathy. What do you mean about sympathy with the patient?
Doctor, sympathy when the patient crying during talking with her.
Yeah.
So he give her the paper, the journal.
Oh, very
Yes.
nice, very nice. He empathize her.
Empathize
By
her,
what?
yeah.
Empathy, sympathy. There is difference between sympathy and empathy.
Sorry.
Sympathy is when you are crying, I will cry with you.
Okay.
When empathy, when you crying, I understand. I will have an action.
Okay.
I consider. I understand your feelings. So he brings a tissue paper.
Tissue paper,
And give
yes.
her. This is a very important point in this video. What is next? Listening to the patient and giving her time. Yes, very nice. Salama, yes. Salama, he was listening to the patient and giving time in 36 seconds. He is listening in 33 seconds. He do nothing. He is not doing nothing. He is all his mind and his heart and his senses with the patient. So Salama says he
was listening to her with all his body language.
By all his senses. Haneen, he was sitting in front of her, not behind the desk. Very nice. There is no barrier of communication. It is very important that you should you should sit in a right angle. The discussion or the dialogue, the medical dialogue should be there is no table barrier, the barriers, anything in the front of the between the patient and the doctor, it is a barrier. Nahid, what she says, she gives attention and emotional response. Very nice. He is his attention is totally, he's listening by his brain, listening by his brain. And Isra, eye contact and give an attention to the patient. Very nice. So all the non-verbal cues you are identified. You had identified. I will repeat the video and please comment. You might discover more than these points.
Doctor, can you stop sharing and share it again with the sound, or I can share it with from my laptop?
Yes, please. Yes.
Or can you stop sharing, please? I'll share from my
yes, I will stop sharing.
Because of the other video. Okay.
Yeah.
Okay.
Yes, Shaima.
Yeah, I'm sharing, doctor. Just 1 second. Okay. Can you see my screen? Doctor, can you see my screen?
Next.
Yes.
No, before this slide. Yes. Shaima, before you share, stop, please stop. I will talk something. Okay, this dialogue, this patient, she came with chest pain because she had her niece has high road traffic accident and died. So she comes with chest pain to the doctor. She explaining her social and her medical problem. So please share the sound. Okay.
Sounds like you were pretty close with your niece.
Oh, yes. She was like a daughter to me. I don't have any children on my own, and I'm really going to miss her. Really. You know, I don't know how we're going to get along without her like this. We're really, really going to miss her. I loved her so much.
Okay. What else? Anybody can share something with about this? Do you add something? Okay. I think the things, yes. Abir, eye contact, yes. One new message, okay? Give her enough time to talk, yes. If you count the time I had counted it, it is 33 seconds. This is the listening skill, very difficult listening skills, the silence in listening skill. The silence is very difficult to master. The great doctor who can listen during embarrassment of the, he knew that she feels before asking. Yeah. I think all the things which you had mentioned. Thank you very much for your attention. He knew how she feels before asking. Yes. Please, shall you continue sharing the slides, Shaima? Okay. Continue sharing the slides when I talk. So the next part in listening, the last technique is picking up verbal and nonverbal cues. Not only mastering your verbal and nonverbal cues, but you should be clever enough to read, to observe. It is listening is not by ears only. It is by eyes observing. Some persons, or even our patients, they can't express their thoughts and feelings in a normal way. It is usually indirectly because of their fears, concerns, afraid from something, from mainly the cancer. It is very horrible things to think about. So they don't express it directly. So we should observe, and not only the disease, the social and psychological problems are social stigma. They can't say it frankly, especially with companion, when her husband is nearby, or when her aunt with him, whatever, it is very difficult to express. So they train around, and they talk by their expression. And when you feel, when you observe a cue, it should be handled very carefully and should be checked with the person. Not take it and understand that you are understanding her cue without clarifying. You should clarify, and the person should admit that you are explaining her cues accurately. The danger in this part is when we neglect. Doctors, more often, they neglect the nonverbal cues. They only use words, and they neglect nonverbal cues, so their amount of information is not representative to what the patient complains. That is why the majority of our medical record are medical side, and they have no nonverbal cues. Next, please. So we have 4 items in techniques in listening. We should wait, and we should facilitate. Then we should master our nonverbal cues and picking up the patient cues. What are the advantages of listening skills? We can read the person. We show the person that we are interested in her talk, and we hear their people's stories, and we refrain from making early assumptions. We don't assume that we know even we are 90% sure that we know the meaning of the person, no, we should ask we don't assume, we should be 100% correct. And listening is prevent us asking unintelligent questions. We can measure the feelings of the speaker, and when we listen, we have high accurate patient speech, verbal and non-verbal. We capture all these things. So listening skill has a potential therapeutic effect, especially in psychosomatic diseases, which we don't use any treatment, drugs. Next. So, what are the barriers of listening? There's a lot of barriers that, as we said, we assume that we know the person how to say, what is going to say. So we sometimes interrupt before he completes his story. And sometimes we focus on our response, not what the patient said. And we don't ask for clarifications. These are the diseases of listening. So barriers of we assume, interrupt, focus on our response and not asking for clarification. These are the barriers. So if you listen carefully, your reply will come out more mature, logical, and quick. Next. Now we've moved to medical interview. I will talk some little points about medical interview, because active listening in medicine is very essential. William Osler have a wisdom. He teach us that listen to your patient. He is telling you the diagnosis. 82% of the diseases we can diagnose only by history, only by listening to the patient. But we ignore this. Look to the next slide. Please, next slide, Shaima. Doctors are not good listeners. We interrupt our patient after 18 seconds of opening their statements. Once he talks, we will interrupt him. And the reasons, we discovered that doctors claim that they have no time to listen. And some doctors, and the society says doctors want to control the encounter. So both of them are true. They have overloaded work, and socially, people say that doctor, they don't let us to talk to control their encounter. So after training, American training of 15 years of listening skills, listening increase in 5 seconds only. It becomes 23 seconds. After hundreds of listening workshops, the American doctors interrupt their patients after 23 seconds. After 15 years of identifying these pitfalls in our medical encounter. Next. Okay. Next, Shaima. So, how much we listen? 92% of our patients need 1 minute to complete their narratives. It is surprising. 1 minute, doctor. You should be 1 minute doctor. 1 minute, 92% of the patient will complete they mentioned all their problems. So please, at least give them 1 minute. Train yourself and count the seconds which you are listening to the patient. And you need more than 6 months to master 1 minute doctor. Next. So, how we interview our patient? We have 3 main skills in our interview. We call it ILS, invite, listen, and summarize. Invite the patient to tell his story. Listen attentively, summarize his narrative. It is easy, but in history taking, we use another technique that we prevent the patient, we don't let the patient to tell his story. We assume, ask, and proceed. So this technique is changing doctor-centered interview to patient-centered interview. It changed the philosophy of the medicine. All the philosophy of medicine will change by the most important sophisticated procedure in our practice is history taking. History taking is a shared procedure formed by doctor and patient. They formulate a story. Patient has nothing in his pocket to give. It is not a history taking. It is a medical interview. It is a dialogue between two persons, two expert people. Doctor expert in medicine and patient is expert in psychosocial life. He give you how he is living with his embarrassment, with his problems. So he's not counting you the signs and symptoms which you need. He just explain how he is living. So he is giving his ideas, how he think about his illness. Next. So how we use invitation. Invite the patient. We call it cone-shaped technique. We ask an open-ended questions, then many open-ended questions. What brings you today? How can I help you? Please continue, and we will summarize. Then we use open-ended questions, but limited. Then we go to close-ended questions. I will clarify in an example next. An open-ended question, you ask the patient, tell me about your headaches. This is an open-ended question. Then I will listen. Then I will ask another open-ended question. I says, what else? What else? Till he finished his questions, I will go to more specific but still open questions. What makes your headaches worse? How you describe your headache? Or what makes your headaches better? These are such questions. I get it from the speech of the patient, from the talk of the patient. When he finished, I will summarize periodically. Then when he don't mention something important, I will do a close-ended question. Do you ever wake up with a headache in the morning when he did not mention this? Do you have vomiting? Do you have pain in the eye, in the nose, or whatever? These are, he says yes or no. These are the skeleton, step ladder fashion. It is open-ended questions, more specific but still open, and close-ended questions. This lets you to listen. Without open-ended question, you can't listen. Next. So listening, we have some details about listening, allowing the patient to complete statements without interruption. Leave space for the patient to think before answering or go after pausing. So listen attentively. Then next, summarize. Next, summarize. So during the open-ended and limited questions and closed questions, we summarize periodically to show the patient that we are understanding his speech. He will correct our interpretation, and he might provide further information. These are ILS, invite, listen, summarize. And I will show you an example of ILS. Please, the next video. So please, the sound is very difficult. It is 4 minutes video. It is an encounter, online encounter. I ask the patient, what brings you to me? And she will answer. Just listen to my questions. I used only open-ended questions. And I don't need to use limited questions or closed questions. She expressed herself very nicely. So please, if you can't hear, you can't read the questions and answers. Okay.
أنا دكتور عبد السلام مسؤول الصفحة اللي اتصلتي بي. ممكن تعرفيني على نفسك قبل ما تحكي لي على شكواك؟
والله دكتور أنا اسمي سوسن عدي، عمري 48 سنة.
أهلا وسهلا.
أنا خريجة كلية التربية. أهلا وسهلا. خريجة كلية التربية بس ربت بيتي. عندي 3 بنات كبار جامعيات.
ما شاء الله.
وابني الكبير محمد.
ما شاء الله.
وزوجي مهندس.
أهلا وسهلا. منين أنت؟ من يا محافظة؟
أنا من البصرة.
أهلا وسهلا. أنا خريج البصرة وأحب البصرة أنا والله. الله يجزيك.
تسلم الله يخليك.
أهلا أم محمد. شنو اللي دعاك تستشيريني؟
والله دكتور أنا عندي مشكلة ألم ركبتين اثنيناتهم، صار ألم مزمن صار له تقريبا يجي 20 سنة.
نعم. احكي لي عليه بالتفصيل من A to Z، من البداية للنهاية حتى أفتهم شنو المشكلة.
والله دكتور هو بدأ بشكل بسيط، يعني أول مرة ألم من أمشي مسافات طويلة كانت توجعني ركباتي. بعدين من قمت أصعد الدرج وأنزل زاد الألم، وأكثر شيء بعدين قام الألم يزيد أكثر شيء بالليل من أنام، يعني فالوجع ما ينحمل، وحتى ركبتي قامت تطقطق وتقفض، يعني تنتهي بعد ما أقدر أمتى.
الله يساعدك.
مشكلة كبيرة يعني.
الله يساعدك. كملي. دا أفتهم الموضوع.
أنا حاولت أكيف حياتي ويا الألم، مثلا بالبيت البنات قاموا يساعدوني، مثلا الصلاة قمت اقتصرتها على الصلاة على الكرسي، وحتى أتذكر يمكن قبل 3 سنوات أنا رحت للحج، يعني كانت المناسك صعبة علي. وحتى يعني سويت قسم منها على كرسي وقسم سوي لي إياها إنابة. فيعني هي بصراحة يعني مشكلة كبيرة يعني بالنسبة لي. كذلك يعني أنا صرت قليلة الحركة، فحتى قمت أزيد بالوزن.
نعم. زين، شنو محاولاتك العلاجية اللي أنت حاولتيها خلال هال20 سنة؟
والله هذه أنا شد ماخذة، راجعت أطباء وماخذة علاجات كأدوية كحبوب، وحتى أعشاب صراحة ما أخذت. وأخذت همة سويت قبل 2 سنين سويت ناظور مال مفصلين الركبة همة، قالوا لي عسى ولا يفيد زين، ولكنه كل يوم الأطباء كلها تقول لي سوفان. شو السوفان؟ ما له علاج دكتور؟ ما أعرف، يمكن راح أتقرب ماله.
إن شاء الله السلامة. زين، شنو اللي ببالك تريدين من عندي؟ شنو الغاية اللي من الاستشارة؟
والله يا دكتور أنا ليش طلبت الاستشارة؟ لأنه أكو سمعت علاج يسموه زراعة الخلايا الجذعية، موجود قالوا بالعراق يمكن أو برا همه، فقلت إذا يفيدني ويعتبر فد حل لمشكلتي ممكن يعني أجربه.
والله صحيح، هذا هسه يسموه العلاج التجديدي، الطب التجديدي، إلى مراكز هواية في العراق وخارج العراق، والمراكز تقول عندنا نتائج إيجابية، بس الجمعيات العلمية الموثوقة تقول هذا بعد تجريبي، لأن ماكو أدلة لنجاحها إحصائيا. يتحمل يعني لا زال علاج تجريبي، يتحمل المريض هو النتائج مالته، بس غالبا يقولش ما بي مضرة، ممكن أنه تسوينه، بس لا تتوقعين أنه يكون نجاح 100%.
اوكي تمام، يعني حتى لو فد نسبة حتى 50% هم يعتبر حل لمشكلتي، لان مشكلتي مزمنة. انا
توكلي على الله ام محمد، ان شاء الله موفقة.
شكرا جزيلا، شكرا على استشارتك.
اوكي، ثانك يو فيري ماتش شيماء. قبل ما ننتقل على الموضوع الآخر، ممكن أن تكتبون you write on the chat bar what do you think, what are what the video brings some thoughts about in your mind. What do you think about this interview? About the open-ended questions, or how the discussion is going on? ماذا أشوف الشات بار؟ دكتورة شيماء؟
معك دكتور.
نعم. الدكتورة حنين تقول he knew how she feels before asking. يعني they نعم. دكتورة عبير تقول complete attention for doctor، يعني كان مركز معاها الطبيب. نعم. أكو ملاحظات أخرى؟ نعم. سلمة you encourage her to talk more about her issue and asked her what she is expecting from this counseling, and then you gave her the opportunity to choose what she needs after telling her the options. Very nice. Salama, she is describing what she is observing. هذا احنا نقول descriptive explanation. When you see any dialogue, medical interview, you should describe not judgmental, not good or bad or something emotional, or it is just you see and describe only. So she saw that I encouraged her to talk and asked her open-ended question and what she expecting from the counseling. Victoria, doctor shows sincere interest. Yes, he shows a sincere interest in the patient talk. Doctora Zainab, give the patient enough time. Yes, I give her enough time to talk, and I don't interrupt her, and I use active listening in this. Abdullah, so friendly and open gate interview. Yes, it is so friendly, and no one says that I am smiling. He keep the client so comfortable. Yes, active listening and give her time to explain her problem. had Dr. Sarah Farhan. Dr. Lana, you have used an open-ended questions. The patient was very comfortable. It was a friendly interview. Dr. Nahid, the doctor was honest with the patient. Yes, I was honest and tell her the expectation, frankly. It is not dependable, it is not scientific, but it is not hard. It is not harm to do, and it depends on your choice. Russia, doctors was very polite and make the patient feel comfortable. He was also gave her an unlimited time to talk without any interruption. He was smiling. Yes, thank you very much throughout the conversation. Guide through into her problem. Yes, David. I am following her with successive open-ended questions, and I got her what is the secret of her consultation. When I don't understand her talk, she had many visits, all the things she did. She did aspiration, she did herbal, she knows everything in her condition. Then I remind myself, why she's consulting me? She put a new idea that she heard about stem cell therapy, and her opinion, she wants my opinion about this approach. So I gave her honestly that this approach is invalid medically, but there is some stem cells in centers in Iraq and other parts all over the world. They do some results, they give us some results, but it is not, it's till now experiential. So thank you very much for your comments, and we will go to the next slide. Shaima. So breakout rooms, so exercise in pairs. Please, every two persons sit together and talk about what they understand from this webinar. Then they listen, the one person is talking, the second person is listening, and they count the time of their listening and what benefit they got. And they turn the exercise, the speaker will be listener and the listener will be the speaker, and you will take 5 minutes for this exercise. Shaima, can you divide them into breakout rooms?
Yes, doctor, she's doing it.
Thank you very much.
انا اصلا كنت واخده قرار على فكره بعيدا. هو يمكن الحاجات دي ظهرت لي حاجات اوضح، بس انا موضوع
Are we in a breaking room now?
So, have you divided them all into groups? I haven't seen anything. Can you see? Can I see them? How they are discussing these things?
Yes, doctor. Okay,
Yeah.
Johnny. Sarah, were you in a break room?
ايوه الصوت معلش.
كنتي ببريك روم؟
ايه؟
كنتي ببريك روم ولا مش ما كنتي مع حدا؟
ايوه انا دوست على بريك اوت وبعد كده لقيتني دخلت في حاجه تانية رحت خارجه.
اوكي هي كانت بريك روم عشان تدسكس ايش يعني شو اخذتي من اللايف سيشن، شو اخذتي انفورميشن.
تمام.
شو اخذتي من البرزنتيشن نفسها، شو استفدتي؟
لا استفدت طبعا الاكتف ليسننج، ان احنا المفروض نسمع الناس اكتر، ندي الواحد فرصه ان هو يعبر الاول عشان اقدر افهم هو يقصد ايه او ايه الحاجه اللي هو عايز يقولها توصل لي المعلومه بطريقه صحيحه. ان انا استخدم كل الحواس في ان انا البادي اكسبريشن بتاعه وكل حاجه، ان انا اعرف ان هو يقصد ايه وان انا اكون فريندلي معاه في كل حاجه.
That's great. بالضبط هو listening، يعني هو عن جد أصعب إشي to maintain listening to someone. It's very hard to listen. It's very easy to talk. And especially the doctors. The doctors always gives advices and most of them, they don't listen. They always give information. So listening is the hardest part in the consultation. And it is the best thing to have the history of the patient. Shema, can you return everyone in 2 minutes?
Okay.
Come on, 2 minutes.
Okay.
شكرا سيزينا. interesting talk. ما أعرف ممكن أن يكتبوا لنا بالchat bar. Please write your opinion about the webinar in chat bar before post test. نحتاج شوية more interactive sessions. ومهارة التواصل ممكن نطبق بعض من ال exercise during online sessions. ولكن الأفضل more important to face-to-face training and repeats training till we master the skills. But the most important skill is listening skill. Okay. Anybody has any questions, any query? What, Muhammad? Rasha said, I recommend to do this webinar to all candidates, and I recommend this second interactive sessions for this group. Yes. Thank you very much, Rasha.
Yes, indeed, we will have another live session with Dr. Muhammad Noor on Wednesday, and inshallah with Dr. Abdesalam, if he has time before the end of this course, which will end on next Sunday. If he has time, we can conduct another live session, inshallah.
I'm welcome. Anytime and anything you want, I am ready to give you anything you like. But very important, listening skill, you should read and practice. Read and practice. Which when you master listening skill, you master 70% of communication skills. You can't use empathy without communication skills, without listening skills. Nana, thank you very much. Thank you so much. I learned how to be an active listener. Salama, thank you very much. Rasha, thank you so much for your patience and your time you gave us. Thank you, Dr. Haneen. Thanks, Isra.
So shall we post the post test?
Yeah.
Okay.
So please fill the post test, and I like from you all. This is you answer correctly all the tests. Don't fail in the answer of any of them, because we give you an overall view about listening skill, and I include all the items in the post test, which is the same pre-test. Thank you very much for your time, Sarah. Abdullah, thanks. And on my side, I am thankful for Sarah, for Zaina, and Shaima, and Dr. Faris, and to all participants who are actively participated in this webinar. And I hope I will see you on another webinar. And on Wednesday, Dr. Muhammad, what are the topics which he will share with us?
Yeah.
Can I share with him?
Yes, just give me 1 second, Doctor. I'll check the title. I will post an announcement in maybe an hour. Just 1 second. The live session will be about public health communication, challenges and opportunities.
Mumtaz. It is the same. It is important subject in public health. Communications, very interesting.
Okay, Shaima, can you stop the poll? Or just give 2 minutes, or I don't know.
Okay.
Everybody complete. Let them complete the.
Yeah.
7.
7 completed. Okay, let's wait another 3 minutes.
انا ما عنديش برضو البوست
نفسه يناهد نفسه ارجعي
هو على الميل بقى كده.
يس ارجعي هلا اقرأي الأسئلة مرة ثانية وحليهم مرة ثانية وشوفي، ودكتور هلا عبد السلام هيعطينا الأجوبة الصحيحة للستيتمنتس. Would there be a certificate of participation? You will have a certificate once you finish the course. Our certificate is accredited by by AFIA, Agency of Public Health in Belgium, and signed by the executive director. So when you finish the course with the assignments, you will get the certificate إن شاء الله.
أنا مش بعرف يعني أعمل حاجتين، يعني أبقى على الميل وعلى الزوم مع بعض، فأنا مش عارفة أعمل إزاي.
بس اقرأي الأسئلة مرة ثانية ناهد
ممكن
جاوبيهم.
ما أنا مفيش مشكلة أقراها. هي موجودة على الزوم طيب؟
موجودة على الزوم، موجودة على الكويز.
طيب هحاول تاني كده.
اوكي.
على أي حاجة بقى؟
بولز.
على إيه؟
بولز.
أنت قلت على بعد الثلاث نقط؟
بعد الثلاث نقط في مور.
في مور. في بول.
هي بالضبط.
تمام.
اكبسيها.
خلاص تمام.
Next session, the next live session will be on Wednesday, the same time. It will be from 6 p.m. to 7:30 Baghdad, Amman, Jordan time, and UTC it will be 3 p.m. UTC time. And Abir, I will send an announcement today or tomorrow maximum, and we will send a Zoom invitation also, a Zoom link also. But please complete your sessions, the self-paced sessions and the assignments, so Dr. Abdeslam and Dr. Abdnoor can correct your assignments, and so you can take the certificate, gain the certificate. I finished the post-test, but I am not able to submit it. Seems like technical problem. Okay, what is happening with Russia?
I don't know. I'm just submitted. But,
Russia cannot submit.
Yeah.
You submitted it?
Hanina, thank you. Zina, Shaima, and Dr.
You're welcome, Haneen.
Thank you.
So you are talking about the assignment regarding the course?
Yes. The assignment
about the grant, how to apply for a grant.
Yes.
So I actually submitted the grant last year for a real grant, and the grant was accepted. So can I just submit it again, the same?
Ask Dr. Abdeslam. Dr. Abdeslam, you did the exercise, the real exercise. You submitted a grant and
accepted.
So you want to send it again to Dr. Abdeslam to grade it. Can she?
Please revise it again. I think 1 year you should modify something more. Not only the same assignment. I need your revision after 1 year, and you have new ideas, new things to add to the assignment.
Okay, no problem. So what is the deadline?
Again?
The deadline, she said.
The deadline. The deadline is this Sunday. The course will be closed, so you have to finish all the sessions, the assignments, and the evaluation to gain the certificate. Okay. Abir, you're asking about the assignment. On your page, the LMS page, you can see the sessions, the self-paced sessions. Under each session, not each session, maybe you have 2 exercises, I don't remember actually. You have to solve the assignment and submit it. If you can't do this, please tell me so we can help you.
And I announced that we have another...
Yes, I did.
Yeah. Zina announced you another webinar on Thursday in 10 o'clock in Baghdad, Jordan, and the Gulf area.
Morning?
It will be about shared decision making.
Yeah.
I will share with Iman Abu Kamil from Palestine, which is living in Australia. She is a very figure. She had a lot of research about shared decision making. So we will, please, if anybody interested, join us at 10 o'clock p.m. on Thursday.
Yes.
You know the assignment, the announcement. Zina mentioned this, but I remind you about it.
Okay, great. Shaima, can you stop the poll, please? And
Okay.
yes.
Yeah.
And let Doctor, because we have, okay. Doctor.
Yeah. Let us see their answering.
Yes.
Yeah. All are right. All are right. Very nice. But you can't listen while using close-ended questions. I think three people says false. It is true. And only this, and we live in communication era, but we haven't enough time to listen. One failed. It is all true. And in the 10th question, listening prevents you from asking unintelligent questions. False. So all the statements are correct. No one is false. Some of you have very little pitfalls. I think 2-3 people have 1 or 2-3 choice, one false. Only one questions have 3 false, but it is true. All of them true. Thank you very much. And please concentrate on this subject, and it will succeed in your career and in your social life. Thank you very much to Zina, and thank you very much to Shaima, and thank you for all of them, all participants. And I hope that we will meet again on another webinar. We will decide it with the IAPH. Do you have anything to close?
Thank you so much. Have a great night or day, I don't know. And see you next live session, inshallah, on Wednesday. I'll send an announcement. And with Dr. Abdesalam on the 17th. Yes, Doctor?
Yeah, the 17th, on Thursday.
On Thursday. See you all. Have a great day.
See you. Bye-bye.
Bye-bye.
Bye-bye. Thank you.
Bye-bye.
Bye.
Bye-bye.
Thank you.
Thank you so much.
Bye.
Bye.
Nice group. Nice group.
Yeah, very.
God bless you.
Thank you, Doctor. Thank you so much.
Thank you, Zaina.
Have a
You
great
are very
day.
good in supporting the webinar.
شكرا
Very
دكتور.
nice.
شكرا.
شكرا
كلك
جزيلا.
ذوق.
شكرا شيماء. شكرا زينة.
Thank you, Doctor.
You were the dynamo of the webinar, and I hope we will go more and do more and more webinars.
Inshallah. Thank you,
Okay.
Doctor. Thank you so much.
Bye.
Have a great night. Bye-bye.
Please join us in shared decision
Allah.
making, because for the pharmacists is very important.
Inshallah, I will. I will, inshallah.
Okay.
Thank you. Bye-bye.
Okay. Bye-bye. Bye-bye, Shaima.
Bye, Doctor.